afternoon. Rachelle Schultz, CEO at Winona Health, here again with another update. Today, the first thing I want to do is to thank all of the people who have been calling us and who have been dropping off masks. We have an awesome group of sewers. I know we have a lot of sewing guilds and sewing clubs in the city. Lots of people have been sewing masks for us that we are able to distribute around to some of our residents and other areas of need, and that's just been incredibly helpful, and so thank you for that. We're really grateful. I do want to put out into our sewers again, if you have any interest, one of the other needs that we have are hospital gowns for patients. So we are actually putting a kit together that would have a pattern and material requirements and some of those kinds of things. So at this point, if you're interested in doing that, you certainly don't have to do that. It's a little bigger project, but if you're interested, you could call 494-7371 and give your name and contact information so that we know how to get that information when we have it all pulled together out to you. So that's one really big thank you and another big ask. So we'll move on from that to where we sit today. So we have had some additional positive cases. We're up to 6 in Winona County. And, we continue our readiness planning, and we've got some really good plans in place as far as expansion of our hospital capacity, equipment, supplies, a variety of different things. So how we approach looking at this and what the demands might be is through doing some modeling. And you've probably heard some of the things with the governor's press conferences, at the statewide modeling of, what they expect to happen across the entire state, both in timeline and all of that. So we have something similar that we've been doing here, pretty much using the same types of assumptions, just scaling it for our size community and surrounding area. So one of the things that would be really important, that is a big ask that I have, all of us here have for our community, is to help us out a little bit by following the stay-at-home request that did come out from the governor's office. The first factor that we consider when we're doing modeling is what is the community spread. How many people in our community could potentially get this virus? And the governor's numbers the other day were approximately 40% that he was using for the state. We've modeled this looking at 30%, 40%, 50%, and up to 60%. So that's the first number. How many people in our community could contract the virus? So we start with that number, and then we start backing that down into all of the models essentially say 85% of the people who do contract the virus can take care of themselves at home. It's all of the symptom management types of things that you can do at home, and kind of isolate yourself maybe from other family members, that type of thing, but it wouldn't require any type of hospitalization. The other 15% are the individuals who might require some level of hospitalization. Most of those would be just sort of the medical hospitalization level. There's a small percentage, 1% or so, that would require ICU level care. So when we model out these numbers, that kind of tells us what is the demand from our community that could come through our doors. Now that demand could get mitigated based on our community's action. So if you're able to stay home, if you're able to either delay contracting the virus or fewer people get it, those are all of the things that help bring that demand down. So again, we've modeled that at the different levels. The 30% is probably one of the numbers that we're targeting right now. One of the things that is good about smaller communities or greater Minnesota is we don't have as much population density as metro areas do, so that probably helps with the spread. However, smaller communities also have a greater percentage of elderly or vulnerable people in their communities, so that might be a counterbalance to that. So we're just working with sort of those types of numbers so that we know what we need to be ready for. we're pretty, we're going to match up, actual experience. We're going to be tracking that. So if we need to adjust our model as we actually see some of this transpire in our community, it'll help inform us a little bit better as we actually have the real data. But that's going to be an unfolding type of a thing. That's nothing we can obviously know kind of into the future. So again, we're just kind of taking this model and I think pretty comfortable with what we think can happen. We're working with the state resources. There's a great state incident command system that's put in place relative to movement of patients and supplies and all of those kinds of things, and they're doing a good job of getting that in place. So we're feeling like we've got all the connections that we need. We feel like we're getting our arms around our supplies and equipment. And this is another huge thank you. So many organizations and individuals in the community have dropped off masks or other supplies that they have or have called us to say how could they help, or manufacturers, what could they fabricate for us, and so forth. So we have been very blessed by the show of support by everybody in the community and our organizations in the community. Our universities had with their nursing programs some supplies and equipment because of their nursing programs that have been offered over, and we've picked up that equipment and have it here on campus, and so we're very grateful for all of that as well. So this has been an amazing kind of community experience coming together to really take care of our own and really do a good job with all of that. So the thank you to everybody, and the big ask is stay home, stay safe, and stay well. Thank you.